from the News Channel 5 Network, this is OpenLine.
Hello, everyone. Welcome to OpenLine. Glad you're with us tonight, talking about a topic that impacts so many people, the pharmacy, and your trip to the pharmacy. Have you noticed longer lines? How is COVID impacting, or this worker shortage, how is it impacting pharmacies? It's impacting so many businesses, but I think we're really seeing it there, perhaps. And we're happy to have with us the executive director of the Tennessee Pharmacists Association. So somebody who knows all about this. Innovation at the pharmacy, issues maybe with burnout, all kinds of things to talk about. But Anthony Pudlo, thank you for being here.
Thank you, Ben. I appreciate you spending some time.
Absolutely. Let's just spend some time together. People can call in with questions if they want. But I mean, all right, how are things in the pharmacy industry coming out of COVID? You know, staffing shortages, those kind of things. Right. What are we seeing right now?
Wow, it's a great question. You know, I think pharmacists, first and foremost, I have to say pharmacists are the unsung heroes right now, along with all of our other healthcare providers in our industry right now. But it's tough. You know, there's a lot going on right now. Pharmacists were dealing with a lot of issues anyway prior to the pandemic, and then you have pharmacists stepping up to do whatever they needed to do for their communities, for the hospitals they work in, long-term care, whatever it might be, whether it was testing individuals, providing answers to questions, now vaccinations, just ongoing questions around any type of infectious disease, it seems like. But you know, I think right now it's an industry that is spurring a lot of innovation. You referenced that word earlier, and I think it's really providing a chance for the profession to be innovative in ways that their community, their practice setting, their hospital needs out of the role of the pharmacist, and really the entire team that supports that pharmacist.
That innovation could change the way, will likely change the way we interact with our pharmacist. And I want to talk about that. But let's talk about where we are right now. What about staffing shortages? Are you seeing them? What impact has that had on?
Yeah, it's a great question. You know, I think right now what we see in terms of staffing issues or concerns, they're really, first and foremost, I'd say from a pharmacist perception, I don't think there is a shortage of pharmacists by any means. Now, there's probably a shortage of pharmacists that want to work in the environments that they're seeing right now. And we can get into a lot of reasons for why that is what it is. We do also see, though, besides the pharmacist, there are other supporting actors in the pharmacy, that being pharmacy technicians, who are ones that many times are the ones being the ones actively counting the pills, if you will, and putting them in the bottles and labeling them and doing data entry and dealing with some of the insurance concerns out there. There is where we do see a little bit more of a shortage of assistance and help with those types of direct care workers that are supporting the licensed pharmacists in whatever practice setting you are. So I know that's not a specific issue, though, just to pharmacy. You know, you look at our colleagues in medicine and nursing, all those other kind of supporting actors to help that licensed professional. There is workforce shortages.
I mentioned innovation. What would you like to see? What is coming in the next 5 years, do you think?
Ooh, good question. You know, I think right now what we're seeing is just whether, you know, you have to look at it from a lot of different angles of what type of pharmacy practice you're looking at, whether it's a community pharmacy, if it's a hospital-based pharmacy, long-term care, home infusion, whatever area you might find a pharmacist. But innovation's happening just from the sheer fact of us having to deliver medications. People need to take medications. They need to take it regularly. And how does a pharmacist help with some of the issues around compliance and adherence to these medication regimens that are very complex at times. And so there's a lot of innovation happening from digital technology and how pharmacists are using technology to enhance that patient experience with the healthcare system, to, I would say, innovation of just how we deliver and provide the medication itself, in terms of what it looks like when you walk into a traditional community pharmacy. And so there's different ways that pharmacists are really trying to better help with the workload and workflow to make that experience a more positive experience. And then I think just innovation in terms of where is medicine, where is healthcare going? I mean, we can spend hours talking about what is dubbed personalized medicine and the role that different types of enhanced tests, liver function tests and pharmacogenomic testing that actually helps us ensure the medicine that you are prescribed and using is the right medication based on all the different factors that go into your DNA and everything along those lines. So there is innovation, I'd say, in every facet of pharmacy happening right now.
I mean, you mentioned it could be that you have an appointment and you go to your pharmacist and you get your pills at a specific time, kind of like you do with a doctor. Now, I mean, a lot of people just show up and they wait in line, and there can be all the, it can be a little tough sometimes.
What we're seeing, and this has been going on for probably the last 15, even 20 years, where we are starting to see pharmacists, not just from the medications they serve, but the service they provide, whether you're talking immunizations, different types of testing capabilities, other ways to ensure that the medicine's being used. There was a push for us to say, how do we actually maximize the time that a patient has with their pharmacist? And so, yes, this movement to creating a more of an appointment-based model. There's technologies that pharmacies are using to ensure that patients are really just having to come to their pharmacy one day a month or one day every 90 days, whatever it might be. And it's really seen as an appointment with your pharmacist to get not just your medications, but to address your questions. Maybe it's to get your flu shot or other vaccine, or get some other type of testing, or verifying that your medicine's doing what it's supposed to be doing.
Is the current model sustainable? When you look at the number of pharmacists, when you look at the number of people who are needing medications, that seems to be growing. Are things, when you look at the people in the pipeline to become pharmacists, is the current model sustainable?
That's a good question. Yes and no, and how I'll respond to that is I do think right now the innovation that we're seeing in the profession is really pushing pharmacies to provide other types of services, like I was getting at. Not just, I'm going to use immunizations because we're right in the heat of flu shot season, I believe, and but immunizations or other ways to diversify what kind of offerings they bring, whether it's home medical equipment, durable medical equipment services, whether it's, like I was saying, different types of testing and treating, other type of collaborations that are happening with their local provider groups as well. But really trying to say that we do more than just dispense a medication and offer that. And so I think that level of innovation we consistently see. Now, to say that there's a sustainable model to that, right now, pharmacists, how they're really paid is really based on the dispensing of that medication. It'd be maybe surprising to you and some of your listeners, pharmacists technically are not recognized as healthcare providers in the Social Security Act at the federal level. And so when we talk about that, that doesn't allow pharmacists to be properly reimbursed or compensated for services that they provide. And so that model right now, if we were trying to move pharmacists into this more service-based model, there's not a lot of mechanisms right now to allow pharmacists to be paid for services. Now they're paid to dispense a product, and basically that's the way that they're able to do so. And if we just look at that model, I don't know if that's sustainable right now. There's a lot of pressures right now to look at how pharmacy can better enhance and use quality metrics to actually deliver that medication at the right time in the right way for the patient that needs it. But service-wise, there needs to be a few more changes, I think.
There need to be changes. We're talking about the way they're paid.
Yeah.
I mean, I'm reading this article. I read this article. It says, frustrated pharmacists are opting out of the insurance system, saving some customers hundreds of dollars a month. So that's good. A small but growing number of cash pharmacies take no insurance, instead selling generic drugs. Is this why? So frustrated pharmacists are opting out of the insurance system.
Yeah, it is probably one of the things that keeps me up at night, keeps a lot of pharmacists up at night, is some of the pressures that are in our system. I'd say the standard individual citizen probably doesn't know too much about the different actors that play into our health insurance model. But one group that I know tends to be front and center of frustration are a group called pharmacy benefit managers that are a system that was put in place to really help with the processing of health insurance claims, prescription drug claims, but they have really added a lot of frustration to a local pharmacist on how they can better provide medication as well as services. And so to your point on this article, we are seeing that where pharmacists, and I won't just say pharmacists alone, I've seen this with our physician colleagues also, where they're opting out and they're going more towards what is some dub it a concierge type model, where an individual patient will just pay a regular fee directly to that provider or pharmacy in this case to really help manage everything that goes into helping them with their healthcare needs. Now, it's probably something that is very innovative, I think, for pharmacy, and something that is still trying to, I think a lot of pharmacists still are trying to figure out that model and what is the right way to do that, because you still ultimately, to really help serve the needs of your patient, whether it's an individual that's, say, on Medicare or an individual on Medicaid or even using a commercial plan, really you're many times having to participate in these insurance networks in order to be able to provide services. So it makes it really hard for a pharmacist to say no, to move to that type of model. But it is an area that I would say is definitely perking up. It's getting a lot of people thinking, like, could we make this work?
So that's interesting. What's wrong with insurance companies? I mean, they're so prevalent. I feel like they get so much money. So insurance companies, what are they doing that's messing, that's causing problems and for some, I guess?
Yeah, it's a great question. I don't want to sit and speak directly for them. Obviously, they have certain things that they need to do in terms of operating a health insurance benefit for individuals, and they have to balance risk and benefit to every aspect in healthcare. But at the same time, I think there's aspects in the health insurance industry that are unregulated and many times being done behind a closed curtain, that the handshakes, if you will, that are being made are really detrimental to how an individual receives, at least in our case, receives a medication and services from their local pharmacy. And so they're not providing choice to a patient when maybe an individual really wants to go to that local pharmacy. They're saying, no, you have to go to our pharmacy, and maybe sometimes it's a pharmacy that the insurance company themselves own. And so they're trying their best to control their costs and what their model shows to be the best, most cost-effective model. But I think it does come at a risk of what does the patient want ultimately. That's really what we hear a lot, is patients want to go to their local pharmacy, but they're many times getting barriers put up by a local insurance company.
That's interesting. Yeah, I think patients want to go and have a pharmacist there, somebody that knows the drug. They can ask questions if they need to, or just have a confidence level that what they're getting is what they should be getting.
Right.
And when you see long lines and you see frustrated people and you see all kinds of chaos or whatever, chaos might be too strong, that's not good.
Right.
And so that's probably what people want. This kind of sets the table. We have a couple calls. Let's take the, go to the phones. There's the number if you want to call in, 615-737-PLUS, 615-737-7587, talking with the executive director of the Tennessee Pharmacists Association, just about pharmacies. Steve. Hello, Steve.
Yes.
Go right ahead.
Yes, my question is, we had a local pharmacist here that had been in business for several years. He had upped and sold out one of the big chains. He never gave any of his customers any heads up on it or anything. We just went up there and seen a note on the door. It said closed, and that was it. It said to go to this big chain store to see about getting your prescriptions filled, and that left a lot of people in a bad spot because not having the heads up on when he was going out of business, that we couldn't go and get our prescriptions ahead of time. And it really was a bad thing on a lot of people, and I was just wondering if that's something that's against the law, if that's okay to do, or if some charges can be brought against them for putting people in a situation like that, or if there's anything that can be done.
You're outside of Nashville, right? In a more rural area?
Yes, I am.
Yeah. Okay, fascinating. Thank you for calling in. What about that?
Yeah, Steve, I thank you for the question, and hate hearing when a local community loses that pharmacy that they want to use. And but to the point of your question about notification, and yeah, I think there's a lot of times pharmacists are really struggling every month to figure out what helps make ends meet, and they very much have to make some kind of split quick decisions on what they do. But at the same time, though, there are some regulations that are laid out by the State Board of Pharmacy when it comes down to situations to really help protect the public from the use of medications. And I know there are some limitations there that maybe it appears that there could have been some areas that the pharmacy could have done a better job, but right now there are some regulations. So I would offer as a follow-up to maybe get in touch with the State Board of Pharmacy. So if you just got onto the state's website or Googled Tennessee Board of Pharmacy, there's a mechanism to at least bring that concern up to them, and they can investigate further if there was any concerns. But there are a lot of states have different levels of regulation in terms of if a pharmacy is going to close, what level of notification needs to be made to the patients as well as to the employees of that pharmacy.
That's very interesting. All right, we have to take a break. Then I want to come back and talk more about that. It's an interesting question from Steve. And rural pharmacies, what are they facing? Mm-hmm. That pharmacist had to make a tough decision. It surprised people, I guess, in that small community. Right. But what are rural pharmacists facing? So we'll take a break, and if you want to call in, there's a number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.